Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope you're well. So, I'm going to preempt this and say a couple things before I get into and dive into this possibly controversial things I'm going to say, but things that come from the heart and things that I see here, unfortunately, pretty routinely, and I think how important it is to recognize this and realize it. Okay? So first of all, I'm saying this, it's out there, it's public. I am not a surgeon, okay? I'm not a general surgeon, orthopedic surgeon, foot surgeon, podiatrist, back surgeon, neurosurgeon, etc., okay? I'm a board certified primary care doctor, certified functional medicine, regenerative medicine doctor. I did do a residency also in family practice and ER medicine. So I want to be very clear about this, okay? Because I'm going to tell you some opinions that I have about surgery and where it's coming from, and I'm encouraging you and empowering you to do something prior to surgery, okay? And let's just say anything that could be invasive. And that is real simple, but is just get your facts, get second, third opinions, and make sure that it makes sense to you, meaning makes common sense, makes physiologic sense. Now here at Longevity Health Institute, we're always looking at you from a functional medicine standpoint, from a regenerative medicine standpoint. And what does that mean? Well, that means we're looking at fixing things or at least stabilizing things that we do here successfully all the time, okay? But we're also making sure that first, we do no harm. First, we don't complicate things. And if at all possible, at least we're very aware of and very open to and discussing what we're doing. In fact, I like to, and I'm proud of this, I like to teach you. I like to educate you. I educate my patients. And this is why I encourage you to send this video to friends and family, because even in people in other states, whether we do a consult with them or not, can at least listen into this stuff in this type of insight of medicine, because it is not and should not be alternative medicine. It should be mainstream medicine, because this is physiology and science and how your body works. So again, I'm not a surgeon, okay? But prior to surgery, I would highly encourage you, whether it's back surgery, spine surgery, hip surgery, knee surgery, whether it's pelvic surgery, a procedure to reverse or improve something, whatever type of thing that you're going to be put under anesthesia or on a knife, that you consider the situation, that you look at options, that you get second and potentially third opinions, that you use common sense. Now, I'm going to tell you a story here today, and this is why, I'm kind of compassionate and motivated and kind of, if you will, I don't mean to be too passionate about this, but is that I heard a story today from a new patient that was horrible, and she's only 45, and I'll tell you the story. But a lot of it came to surgery that went wrong and that was very likely unnecessary, and I'll tell you where it all started from and what happened. But sometimes these things happen, and we see them here. We see people get surgeries that are really unnecessary. Yes, they're excellent surgeons, and in their wheelhouse, they're doing the appropriate right thing for something structural that's off. And I'm not even suggesting that any of these decisions were wrong on any surgical point. But when a patient, okay, who is, we are your advocate, you should be your advocate, family, friends, loved ones should be your advocate, you need to understand the physiology and what's happening, why you're having the surgery, where you're at physiologically from a foundation of health, because it's about recovery and healing, not just the surgeon and the surgery, okay? A lot of complications and albeit side effects or poor outcomes are not the surgeon's fault, or are not the wrong surgery's fault. It's you. It's where you're at and where your health is at going into surgery and then post-surgery in your recovery. So keep these things in mind, please, because second and third opinions and pumping the brakes a bit so that you understand your health and how you have to heal, okay? Because you do need low inflammation, a good immune system, good nutrition, good blood flow, no stress for things to heal appropriately in a timely manner. So keep those things in mind. So here's the story of my patient today. Unfortunately, new patient saw me. I brought in our infusion nurse to listen in and learn some things because this case sounded unique and also slightly sad, but I wanted to make sure that we could help her best. And I think ultimately she's going to need some infusions and some nutrition and some things that can help her heal and create less inflammation. But she is 45 years old, a female, and essentially she came here because she lives in severe chronic pain. She has chronic pain in her right lower pelvis, and it radiates down into her leg. She has numbness and even weakness, and even sometimes her leg can give out. She has very painful intercourse, and she has at times bladder incontinence. She also has something called a rectocele and a cystocele that complicate using the bathroom at either end, and she has a bad digestion, so she gets belly pain and belly cramps and frequently fluctuating bowels. She also has some underlying immune issues that are autoimmune, like psoriasis, even a severe one like plaque psoriasis. And it's covers about 70 to 80% of her body. She also has some inflammatory arthritis that they suspect might be rheumatoid or a lupus type of a inflammatory reaction in her body that's causing arthritis. And she has had a multitude of conditions that essentially chronic yeast infections, chronic complicated infections from surgery, and complications in her skin as far as infections. And you can see here that at 45 years old, sadly, this is very, very complicated and kind of a mess. Well, she had a hysterectomy in her 30s due to an imbalance in hormones. And this imbalance in hormones that caused complicated procedures she had excessive bleeding and endometrial issues, etc. But some procedures that she had done, like ablations, and then ultimately she had to have a partial hysterectomy. They left her ovaries, but the surgery was so complicated and difficult, and she had these ablations done, I think, more than once, if I recall. And she then developed a lot of inflammatory scar tissue, and then had a bladder suspension where they laid mesh in, and that got rejected and complicated. And that mesh and bladder suspension was due to very commonly post-hysterectomy, women eventually in hormone decline, etc., will have some bladder urgency and incontinence. And she then at that time, remember I said 30s, at the time she was about 34, 35. She then developed all this inflammatory and scar tissue and mesh rejection, so she had to go back in, and they did more surgery to remove the mesh, which then was very scarred down in that. They injured nerves in her right lower pelvis and in her omentum in her pelvis and in her essentially digestive area. And that is what complicated the pelvic pain and the stuff into her right side and her right leg, and right debilitated numbness and weakness and even gait issues. So she had stuff with instability for a number of years. For 2 years, she was on and off a walker and a wheelchair. And again, reiterate, this all started in her mid-30s, and she is currently 45 and been dealing with this for the last on and off 10 years. Now, what else developed? Now the psoriasis, the autoimmune, the complicated healings. She actually has scar tissue and plaqued down areas in her urethra and vaginal area that cause painful intercourse and hard for her to have a relationship and date and have intimacy, and obviously for obvious reasons, okay? And then obviously some infections that I mentioned, yeast and complications. actually, a lot of this started prior to that, when she was even a tween and a teen, because she started with bad digestive health and had a lot of stress in her life, in family issues, etc. And she really had chronic irritable bowel, etc., and these types of things going on. And her mother had this as well in her life. She had bad digestion. Now, if you watch previous videos, you hear me say your gut health, a lot of it comes from innately your mother. And then you have your gut, and then depending on how you live and eat and things that happen. So she developed from a bad immunity, bad digestive health, irritable bowel. You've heard me talk about leaky gut and yeast and these things. So a bad system to begin with, then hormonal issues that could have been fixed and reversed, could have been addressed at least to some degree, procedures and surgeries that then caused all these complications. She's actually 45 and on disability. So again, the term I used earlier is some of these things could have been recognized and treated and addressed literally 20, 30 years ago, okay? And yes, it's very easy to be the Monday morning quarterback and look back at the past and what coulda, shoulda, woulda. But you, and who you share this video with can educate people and enlighten them, and you can affect lives, saving lives, and complications and misery and chronic pain and immune issues, etc., by appreciating a systems approach in your body that really makes your foundation of health well. And then surgeries, well, you see if it makes common sense to you, and then your surgeon's opinion, and maybe second opinion and third opinion, etc. Have a good advocate in your corner looking at the whole picture, okay, before you rush to surgery. Now, there's wonderful surgeons we refer to all the time. I do. I personally have had surgery, okay? But again, done justly with a good immune system, with things that support the healing, and also understanding what the surgery is and was, and what can help you recover and be back in a place where you obviously would want to be, okay? Strong, healthy, and thriving, essentially. So please, please, please bury this in your brain. Share with others and loved ones. But surgery is not always the answer. When there's significant structural issues and things that make sense and common sense, and it's the right thing to do in a physiologic understanding of wellness, of course, okay? But think about the whole picture and take your health as a look at this foundation here, like we approach a patient, every patient, in a personalized way. And you can do this yourself and looking at your health picture. Where are you at genetically, hormonally, digestively, and diet, toxins and detox, stress, mind, body, psychological stuff, and pain, structural issues. So the pain structural issues matter. Remember, that's one of our 6-point model. But the other 5 are also have to be solid for you to heal and be well. This is Dr. Lewerenz. Thanks for listening in and tuning in. Follow us on the web. Share with others. Me and my practitioners are here, open, taking new patients, and happy to help you. And you know, it's what we love to do. So you have a good evening and be well.